I would like you to appreciate how I, along with the patient, arrive at the most appropriate treatment. Let's look at this young man who happens to have a visually obvious main concern and follow his experience. His smile-specific concerns are: 2 front teeth are darker and more yellow, previous teeth whitening attempts did not satisfy him or his dentist, bonded fillings previously placed on those 2 dark teeth had chipped off. He was entering his last year of college. He did not want to have to worry whether his smile might be a factor, however subtle, why he did not get a job. And as many of us are, he was also aware that an improved smile might help him in social and professional situations. We will need to consider the smile and the health implications. When he was 7, there was an unfortunate sports accident. While playing baseball, he was hit in the face with a batted ball. The teeth had been dark yellow for the past 15 years. He's had root canal therapy, composite bonded fillings, internal whitening, sometimes referred to as walking bleach, and removable sequential clear orthodontic therapy. Let me show you what root canals look like on a digital panoramic X-ray. This is the gutta percha, and these are the fillings at the top of the tooth on the back at the top of the root canal. Why did he seek a second opinion? He was not sure he wanted to have his teeth shaved down for porcelain veneers and crowns, and the cost estimate for that treatment was significant. His dentist had recommended a combination of porcelain veneers and crowns. These 2 teeth were previously bonded, but the fillings kept on chipping off. He had orthodontic therapy in high school, but he admits he wasn't as compliant as he could have been. He had those teeth bleached, but they were still dark and slightly lighter, and the lighter look only lasted a couple of months. Once a dentist has seen bonding, teeth whitening, and orthodontic therapy be unsuccessful for a patient, it is not uncommon for them not to recommend those same treatments again. They might be more comfortable starting fresh. So he searched the internet to see if he could find some of the treatments which would give him what he wanted: a natural-looking, healthy, and long-lasting smile that would fit within his and his parents' budget. While I proposed similar sounding dental treatment to those previously provided, there were distinct differences that I was confident would yield better and longer-lasting results. It could not be determined whether the goal of his orthodontic therapy in high school was mainly for aesthetics. From his description, it appeared the focus of his prior ortho treatment was simply to eliminate the crowding and straighten his front teeth, and to close the gaps on the top and bottom front left teeth that were visible when he smiled. These are the bird's eye views of his teeth. The tops are on the left with the darker background, and the bottoms are on the right. The bottoms, the tops. From these views, it's easier to see the crowding that's present on his front teeth. Here's one aspect that distinguishes my technique. My first step is to idealize the arch forms on the top and the bottom teeth. Then I make sure the back teeth mesh as well as possible. Last but not least, I address the function and appearance of the front teeth. This is an ideal indication for the Manhattan Method for teeth whitening, a technique I developed in 2010. The primary purpose is to conservatively correct uneven smiles where 1 or 2 teeth stick out because they are darker than the others. This will be done concurrently with his Invisalign therapy. These photos are from a different patient who had the Manhattan Method for teeth whitening. Notice the front dark tooth now blends in quite nicely. That patient had also considered porcelain veneers, but chose the more conservative, healthy, and affordable technique. This patient also had the walking bleach technique performed with very limited success. And as you can see, The results are now natural, yet quite dramatic. Because his prior bonding kept chipping and dislodging, my plan was to place the fillings on his teeth near the end of therapy, once his bite had sufficiently improved, as opposed to the beginning. A bad bite, the formal term is malocclusion, can lead to undesired chips and cracks in teeth, fillings, and crowns. Before treatment started, I did a virtual simulation of what I expected the fillings to look like. While some might deem this overkill, my goal was to minimize the likelihood that any teeth would receive excessive forces that could cause them to chip or dislodge in reaction to a bad bite. I tried to minimize the likelihood of emergency visits. As a D1 student athlete, he had very little free time. With proper planning, seeing patients every 4 to 6 months works out just fine. As you can see, there was a dramatic difference over the 9 months of therapy. This is how he looked after 1 month. While I did not see it, he reported that by the end of the first week, those 2 teeth had become lighter than at any time during any of his prior whitening treatments over the past 15 years. After 4 months, the ring around the necks of the teeth by the gum line, the last remaining portion of the darker areas, they became lighter. Also, the deep stain that was present at the incisal edge or the tip of the tooth, it appeared as if it had received a filling. It had not. It was simply the deep stain becoming less and less noticeable. This was shortly after the 2 composite bonded fillings were placed. At this point, his therapy is approximately 85% complete. Clearly, he achieved a wonderful result. What's so nice about this outcome is that the shading has blended in beautifully. It projects a natural, highly lustrous appearance. The bite is still being tweaked. It's just about there. From a health standpoint, he is absolutely thrilled that no teeth had to be shaved down. His mouth feels the best it has ever felt. Everything fits just right. The other benefit, this treatment was a fraction of the cost of the proposed treatment for the porcelain veneers and the crowns that were recommended by his hometown dentist.